concerns regarding the understanding and treatment of children with gender dysphoria. Some of the things I say here have to some extent been said, but I'm saying them slightly differently. So the first thing to say is that the very word transgender is a useless term because it covers a multitude of different kinds of thing, as I hope we will discuss. And it's very important to differentiate gender dysphoria from transgender. The former, then, gender dysphoria, refers to deep feelings of discomfort with the sexual body, which has multiple sources and multiple therapeutic approaches. For example, one can think, as I will talk about shortly, issues to do with sexuality, various comorbid conditions, autogynephilia. Autogynephilia refers to a male sexual activity where a man likes to will dress up as a woman and masturbate in a mirror, being very excited by the appearance of himself as a woman. And of course, there's nothing wrong with that at all, if that's what someone does in private. However, there was some of the people suffering from autogynephilia then moved in to become were drawn into the transgender movement. So that's another sort of route. Transgender refers to those individuals who have completed or are embarking on medical and surgical intervention aimed at altering their sexual bodies. However, services pressured by trans ideological lobbies, by an increasingly hegemonic zeitgeist, fail to discriminate between the two, that is, gender dysphoria and transgender, with disastrous consequences. Now, there are multiple routes to gender dysphoria, and the list is long, but would include the following: the presence of various psychological disorders. And that reminds me something from your paper, Stella, that you showed figures for suicide, and in the bar chart, one of them was for gender dysphoria. But I just thought probably that bar itself doesn't make sense unless there was some way of differentiating gender dysphoria from other comorbid conditions. That is, in the discussions of suicide and suicidality, if someone has gender dysphoria, they often have many other disorders as well. But the thing that gets recorded in these online surveys is just the gender dysphoria or the transgender, not the comorbidities. So that it's a very false way of representing things. So various psychological disorders, including depression, autism, of course, children who, for multiple and complex reasons, live a lonely and isolated life, feeling they have no place in the world, are psychically lost and homeless. Serious family disturbances common, often with intergenerational transmission of major trauma, such as child abuse in the mother or the maternal line. This is sometimes a source of the mother not wanting a girl child, something that can be conveyed consciously, but often much less consciously to the child. The girl child picks up the mother's discomfort with the girl's sexual body. Some families have suffered other major traumas. For example, families where there's been, say, the death of, say, a female child. And then the dead child's brother suddenly presents as being trans, as being a girl. But what's extraordinary about that is the lack of interrogation of what would be obvious to any first-year psychologist. Is this child identified with the dead child? And is, so to speak, he trying to give the parents back their daughter? Any family therapist would think of that immediately. A very important causal route, well described in the literature, is related to homosexuality. It is not uncommon for a lesbian girl, for example, to think that because she's attracted to same sex, she must, in inverted commas, really be a boy. Some children who show characteristics of being gay or lesbian find this is not tolerated by the family, sometimes overtly, but equally often in more subtle, even unconscious ways. And one of the characteristics of this whole area, and what is quite disturbing that should be happening at the Tavistock, is a superficiality. That is, I said, subtle and unconscious ways. There's a focus on very, very superficial surface phenomena and lack of probing underneath, which, of course, somewhere like the Tavistock it's very bread and butter. The children also internalize this intolerance of their sexual orientation, which again becomes manifest as hatred of their own sexual bodies. Stella said something related to this, and maybe I just put it in a more slightly psychoanalytic way. That is, it's common, it's not universal, but it's very common for girls to become very disturbed in puberty. And one of the ways of thinking about this is that a girl pre-puberty, when she has thoughts about sex and sexuality, may project them into the mother and think of all that disgusting thing that the parents do or the mother's involved with, how filthy and disgusting. And that's in a way defensive and helpful. But then as she enters puberty and sees breasts growing and her body changing, at an unconscious level, that can be experienced as mother's entered her body, that she's losing control of her body. Some alien force, identified perhaps with mother, has got inside her and becomes a source of great distress and hatred. And a lot of girls have to manage that in various ways, some more successfully than others, but many women I've talked to recognize that. And many studies have shown that a lot of these children will be helped if they're looked after in a proper manner, end up being gay or lesbian without undergoing transition and being gender non-conforming. This also illustrates the way that gender as a category has come to obscure discussion of sexuality and the materiality of biological sex.